Second white coat. Subscribe and like. Let's learn medicine together.
Today, we're diving into a medical mystery. We're going to witness a medical emergency as it unfolds and go deep inside the human brain to understand the anatomy of a stroke.
So, let's set the scene. It's a completely normal day. We have a 59-year-old man. He's up in front of a crowd giving a lecture. Everything seems absolutely fine.
And then, just like that, with absolutely no warning, it happens. His speech starts to slur, his right arm just goes totally limp, and his leg gives out from under him. He collapses. And just like that, the entire lecture hall is thrown into chaos.
In that exact moment, something catastrophic is going down deep inside his skull. So, this is the central question we have to answer today. What in the world is happening inside his brain?
Okay, so our patient is rushed to the ER. The clock is ticking, and the investigation begins right away. The medical team has to start gathering those first critical clues to solve what is truly a life-or-death puzzle.
All right, let's open the case file. Here's what we know. First, his blood pressure is through the roof. That is a massive red flag. The symptoms? They're classic. Sudden weakness on one side, confusion. Now, his history of uncontrolled high blood pressure and being a former smoker, that gives us a really strong lead. And check this out, the neurologic signs, that upgoing plantar reflex, that's a huge clue. See, normally, when you stroke the bottom of someone's foot, their toes curl down, but his big toe is pointing up. That tells doctors there's damage somewhere in the central nervous system. These aren't just stats. These are the very first pieces of our puzzle.
So all these initial clues are pointing in one very specific direction. But to be sure, the doctors need to see it with their own eyes. It's time to get a direct look inside his brain with a CT scan. This is where we're going to get our big break in the case.
And there it is. The scan shows a bright white spot deep inside the brain tissue. Now, in the language of radiology, this is what's called a hyperdense lesion. And in an emergency scan like this, a bright spot like that means one thing and one thing only: blood.
So now we have a name for what's happened: an intracerebral hemorrhage. It's a bleed. A blood vessel has literally burst, and blood is now flooding right into the very delicate tissue of the brain. The what has been solved. But the bigger mystery, the one we really need to figure out, is why. Why did this happen? To get to the why, we have to identify the culprit. And in cases just like this one, there is almost always a prime suspect, a silent offender that's been working in the shadows, doing damage for years.
I want you to meet the Charcot-Bouchard microaneurysm. Just think of it like a tiny, weak bubble forming on a very old, very brittle pipe. For years and years, high blood pressure has just been relentlessly pounding against the walls of these tiny little arteries deep inside the brain. Eventually, they weaken and they bulge out, and these little microaneurysms are incredibly, incredibly fragile.
So here's exactly how it plays out, step by step. It all kicks off with chronic high blood pressure. This constant, non-stop stress weakens those little arteries, which allows those tiny microaneurysms to form. Then, one day, the pressure is just too much. That little bubble bursts, and the result is a devastating bleed deep inside the brain.
But, you know, a good detective never ever settles on the first suspect without ruling out all the others. We've got to look at a lineup of other potential causes to be absolutely certain we've pinned down the right one.
Okay, first up in the lineup is the ischemic stroke. Now, this is the other big type of stroke, but it's caused by a blockage, not a bleed. And the key piece of evidence that rules it out immediately is our CT scan. A blockage just wouldn't show up as a bright white spot of blood. So suspect number 1 is cleared. Next up is another kind of bleed, called a lobar bleed. The crucial difference here is all about location, location, location. Lobar bleeds happen closer to the surface of the brain, and they're usually caused by something totally different. Our bleed is deep, right in the territory of those tiny arteries that get hammered by hypertension. So suspect number 2 is officially out. And finally, what about a different kind of aneurysm, the one you always hear about, the berry aneurysm? Well, that kind of rupture causes bleeding around the brain, not into it, like in our case. Plus, it almost always comes with what patients describe as the worst headache of your life, which our patient didn't report. So we can confidently rule out suspect number 3. With all the other suspects ruled out, the evidence is just overwhelming. The investigation is complete. It is time to deliver the final verdict in our medical mystery. This one sentence right here tells the entire story. It is a direct, unbroken chain
that leads from a very common, very treatable condition, chronic hypertension, all the way to a catastrophic neurological event. This is the absolute key takeaway from our case.
So why does all of this matter so much? Because high blood pressure, as you probably heard, is often called the silent killer. You don't feel the damage it's doing day in and day out. This case is a really stark reminder of how that silent damage can just build and build and build until it's too late. But the most important point, the one I really want you to hear, is that this was preventable.
This whole devastating event that we've just unpacked, it all began silently, years earlier, with a number. And that leaves us with one last critical question that I want you to think about. Do you know yours?